I'm with Isabel Pereira and Dr. Amanda Morelli. We're going to talk about tests, lab tests, all kinds of stuff that we have accessible to us as naturopaths. How are you guys?
Good.
Good.
Yep.
Okay.
How are you?
All my technical stuff had me spinning, but I'm okay. I think I got everything where I want it to be. So, Isabel, why don't you tell us some of the things that you prepared, and then we'll start jumping off from there.
Okay. So I'll introduce myself. I'm Isabel Pereira, and I'm sales manager at Incommon Laboratories, Integrative Laboratory Services Division, which was created in 2015 to service Ontario naturopathic doctors. And we've expanded since then. We're servicing naturopathic doctors, not only within Ontario, but within Canada, as well as medical doctors and nurse practitioners as well. So we offer a lot of integrative or functional lab tests to Ontario NDs who would otherwise not really have access to it because of your regulation. So today we can talk about several different tests. We can talk about the ones that are most commonly ordered. And the ones that are most commonly ordered seem to be very related to what NDs typically are seeing in clinic, which is a lot of gut issues as well as hormonal issues as well. So is there a test that you want me to start with?
You can tell me something that I don't know a lot about, but because I know, I'm a big fan of the food sensitivity testing. Mm-hmm. But why don't you GIMap, perhaps?
Okay. Yeah, so I can start with GIMap. GIMap is a stool microbiome test. It's a very comprehensive test. It's PCR, or also known as a DNA-based test. And it's looking at or reporting out different pathogens. So it's looking at bacterial, parasitic, as well as viral infections, or pathogens that the patient might be exposed to, and looking for certain toxins that these pathogens might be creating. But it's not going to give you an indication of the level of toxin, but it will give you an idea of the toxigenic strains that are being created by the pathogens. So it is a one-day stool collection that a patient can comfortably collect at home. The sample is sent in and it's analyzed, and it is a good test for anybody who is suffering from any sort of gastroenteritis type of condition. Some of the other conditions would be anyone with a chronic or acute, like I said, gastroenteritis, IBD, so inflammatory bowel disease, IBS, irritable bowel syndrome, autoimmune disease. If someone is suspecting they might have SIBO, which is small intestinal bacterial overgrowth. If they're suspecting that they might have H. pylori, any sort of yeast infection, intestinal permeability or leaky gut, which you would probably know better than a patient, as well as any viral pathogens. And so common symptoms that patients might be experiencing who would benefit from this test are constipation, diarrhea, bloating, acid reflux, pain in their stomach, or even, again, like I said, some sort of irritability in their bowels after they eat. So digestive issues.
So it could be almost anything that they might be experiencing. That test will sort of narrow down and help kind of make sense of it. Because we can throw a dart at the board and be like, okay, I think you have H. pylori. But this will really kind of focus down to okay, but this is what's actually happening. This is where your limitations are. Yeah, exactly. It's a great test.
It does report out H. pylori as well as the virulence factor. So that will give you an even more precise indication of if they do have H. pylori, how best to treat it depending on if any of the virulence factors are also elevated.
Okay.
Yeah. I think Dr. Morelli has had some experience with GIMap.
Yeah, I have.
What do you think of the test?
I really like it. And the other thing I like about it is how it breaks down for you what your normal flora is like. And it will tell you if you have low levels or high levels of certain bacteria in your gut. So I don't know if you wanted to share anything else about that, but I like that part too.
No, nothing to add there, but exactly. So it's going to give you a great overall picture of the, healthiness of your gut.
Mm-hmm. Yeah. What do you with your experience on that test? What do you feel like it helped you identify? Did it change the course or the treatment, or did you give you something else to a different way of addressing it than what you would have expected?
Yeah, I definitely like it because I find that it just definitely tells you what is going on in the gut rather than just having to guess, okay, maybe you have SIBO or maybe you have Candida. And I think some patients also like knowing exactly what's going on. It gives them a little bit of reassurance. So it's like, okay, yes, I have Candida, and now I can take this approach and this protocol to treat it and to get rid of it rather than just taking your word for it, if that makes sense too. And then I found that knowing specifically which types of bacteria they have, then we can target those appropriately. Rather, like if it's SIBO versus Candida, we can take a certain approach to it.
Would you say it would even help you in determining what would be a good probiotic for that patient?
Definitely. And definitely based on that, what I was talking about, like the good gut bacteria, we can see what appropriate probiotic would be needed based on what their gut flora is looking like.
Okay. So for patients, this is a much more clearer picture, more definitive, and probably minimize the risk of like trial and error. Well, they said this might work, or this should work, or if I have this condition, now we're like, you have this, and this is how bad you have it, and this is what has been proven to treat it.
Exactly.
So, yeah.
So I think in the long run, it will save patients time and money.
Yeah. Awesome.
It will.
That's amazing.
Yeah.
So you're not guessing, so you'll know right away, right from the beginning, what you need, what you're looking at. Yeah. Create a treatment or a protocol for that patient, and then they'll start feeling better a lot sooner than if you were, okay, this didn't work, let's try that.
Yeah.
This
Okay.
didn't work, let's try that.
Yeah.
You know, and it's a step further than food sensitivity.
Mm-hmm.
Food sensitivity is great, but I've noticed that in my experience working with naturopathic doctors, 5 years ago, the food sensitivity test was like almost one of the first tests they would turn to. And now it's like, no, let's look at the gut. Let's heal the gut. Then we'll look at food sensitivity. Because
Yeah.
once the gut's healed, then you don't have to worry about intestinal permeability and that being the cause of so many foods being a trigger for that.
I have a feeling if you heal the gut, you probably don't have the sensitivities as much. It's probably,
Exactly.
they just sort of magically go away.
So then when you do, if you do follow up with a food sensitivity test afterwards, then you're actually finding out which foods the patient is actually sensitive to, as opposed to was it created for, are these foods elevated for some other reason?
Sure.
It's
Okay.
definitely true. Because a
Awesome.
lot of times the food sensitivity can come back with a lot of things being elevated, and that might just be due to their gut is just reacting to anything and not necessarily a true food sensitivity for them.
Absolutely.
Yeah. Yeah, that's a great point.
And then it's pretty scary to get back a food sensitivity test and half the foods are elevated and you're like, what am I supposed to eat?
yeah.
Yeah, well, I mean, I talked to someone this morning about it, and that's one thing you learn with experience is like, okay, you don't remove 60 foods from their diet because they'll be malnourished, and it's probably not really addressing the main concern.
Exactly.
Even with I still like food sensitivity testing, but I'm finding that it's just highlighting more of what I just see or know like empirically is that gluten dairy is just bad for you.
Mm-hmm.
So I don't know if I don't think that goes away. Like there's no test that's going to be like, well, now you can have gluten and dairy.
Yeah. And I guess that has a lot to do with the way our wheat and breads are being manufactured.
That's the problem.
Yeah.
We're
That's
looking
the
at
problem.
glyphosates, we're looking at, food manufacturing, and a lot of that's probably more of a bigger reason why people can't tolerate gluten or dairy nowadays.
You had another test that you had mentioned. Which one was it?
The GI 360?
Yes.
Okay. So GIMap is from Diagnostic Solutions. Oh, I should have mentioned that In Common Labs is a ref out lab. So we refer testing out to different labs, either within Canada, the US, or even Europe. So GIMap is a test that's run by Diagnostic Solutions in case any patient is looking for that specific test. And the other one is offered through Doctors Data. GI 360 is a PCR test, but it's also the traditional culture test. So it's both methods in one. The collection is a little bit more, how do I explain this? It's a 3-day collection versus a 1-day collection, which is what the GIMap is. So the patient would have to collect 3 samples within 7 days of the first sample being collected. But generally, that's not an issue unless you've got a patient who is constipated or maybe is uncomfortable collecting, but not an issue really. And whereas the GIMap test is a quantitative test, the GI 360 is showing results or it's basing results and comparing it to what a normal biotic reference population, so what a normal person's gut is. And the results are reported in standard deviation. So either, 1, 2, or 3 standard deviations above what normal should be, or 1, 2, 3 standard deviations below. The good thing about testing both PCR and culture is that in the doctor's data test, they can also provide information on susceptibilities. So if you did want to prescribe a microbial for your patient, so let's say grapefruit seed extract or oregano oil, you could actually, the test will show you if the patient will respond well to a particular microbial versus another one.
Oh, wow. That's great.
Yeah.
So do you know how many it tells you for?
I believe there are about 6 or 7.
Okay.
Yeah, of the most common ones.
The most common ones.
Yes, as well as some antibiotics. Nice. Yeah, 2 or 3 antibiotics.
Okay. That's great.
Yeah. So it's a lot of good information as well. Another big difference between the two tests, though, is that H. pylori is not reported in the GI 360 test. So that's something to keep in mind.
Okay.
But otherwise, I think it's a really good test to also consider for patients.
Can you speak to the shift towards the genetics behind your gut, like the gut genome, like the buildup of the different bacterium and testing for that, and how that's sort of changed over time, and like how it's shifted? I know I was throwing you a little bit of a curveball because I've spoken to some people in Manitoba that they are focused on like insoluble fiber and how the gut responds to like neutralizing like pathogenic bacteria, and actually starting to promote the growth of your own innate biome. I mean, is there any like what tests would you say would elucidate that or highlight that and kind of give us a direction? Is that too much of a curveball?
Yes and no. I mean, I know the tests that we offer attendees very well. If there's another test out there that can do that, I'm not familiar with it. So when I say it's a DNA or PCR-based test, it's not an actual patient DNA test. It's the DNA of the actual pathogens that is being looked at.
Okay.
So it's not really a genetic test.
Right. Okay. That was a curveball, but okay. I figure like it would. And
good question.
It's a good. Sure. I mean, and I didn't know the answer when they asked me, so I thought I could throw it to you.
Okay.
But I think it would be a good thing where, like how a lot of people were doing like DNA testing. They're like, oh, I did my 23andMe. Like I'm like, they know their ancestry and they know like what some alleles they have that are like SNPs and this and that or mutations. I think it would be great to like get like a stool sample and get a full on like, okay, this is what your native biome is supposed to be. And then start tailoring a protocol that'll be like, okay, we're going to shift this. We're going to, improve this and these herbs or these kind of starches or insoluble fiber and whatever, we're going to kill off the bad and then promote the good, because like it's along the lines of like, I mean, it's like outside of anyone's normal scope. But I mean, some people are doing in the States, like stool transplants,
right?
Yep.
Which is
fecal.
Fecal transplants. So it's like, that's crazy.
Yeah.
But in theory, it's like, well, that makes sense. Like if you take someone's good stuff that's coming out of them and put it in someone that's not doing well. I've had patients tell me that they've done it, they've undergone it themselves and swear by it.
Yeah.
I don't want to say what condition they help, because I want people to that have that condition be like, oh, he said there's a cure for it. I'm like, but this person, it helped. So there's room for that growth. And I mean, I think there might be some tests out there. I mean, maybe.
There may be. I'm not familiar with them, but there may be. And to be honest, then it would be something that, we'd have to look at in terms of, does it fit into the scope of testing that an ND in Ontario can order? So,
right. So, I mean, I think we're not there yet.
And not to mention, I just want to say that we only work with regulated and licensed laboratories. So if the laboratory that's running that test is not accredited, so we're not regulated, accredited or licensed, then we wouldn't be able to work with them.
Right.
So we want to make sure that we're working with high quality laboratories that are providing accurate results for our practitioners.
Just a question about the GI 360. So is it similar to the GIMap where it looks at the normal microbiome and tells you?
Yes. Yeah. So you will get very comprehensive information on the different bacteria, just like the GIMap test. So the different phylogroups or phylogroups. Yeah, it's absolutely as detailed. Yeah.
Okay. And then it also has candida and viruses. So pretty much all of that is the same, just no H. pylori.
Just no H. pylori.
Okay.
Exactly.
Okay. Is there any certain situations you would recommend one over the other?
That's a good question. I cannot make those recommendations on behalf or for a practitioner, so it's always up to them to decide which test is best for their patient. I can just provide you with the information that's on each of the tests, but then ultimately it comes down to, I guess, your intake or the information you have from that patient in terms of their symptoms, what are they experiencing, and then determining which of the two tests would be most appropriate for them.
Okay.
Yeah.
Fair enough.
But if you suspect they have H. pylori, then I would think that you would want to go with GIMap.
That makes sense.
Yeah. And the tests themselves are about the same price, so that wouldn't be a deciding factor.
Okay.
It would really come down to what information you're looking for.
Okay.
Mm-hmm.
Changing speeds. I like the Dutch test.
Mm-hmm. Mm-hmm. I'm going to mention one last thing, and I think this is a good transition into hormone testing. Another, both tests, the GIMap and the GI360, report out beta glucuronidase.
Yeah.
And that's an enzyme that's looking at how well the patient is able to detoxify estrogen.
Yeah.
And so if estrogen is not being eliminated, then it's just recycling back into our system and then creating an estrogen dominance picture in the patient. So that's another really important marker that's included in both tests.
And so I've seen it in the GIMap where it will show you if it's like high or low. And the same thing in the GI360, we'll just report it if it's high or low.
Exactly.
Okay.
Exactly.
That speaks to the importance of fiber.
Absolutely.
Because that's what's going to help get rid of that excess estrogen. And then sometimes, like perimenopausal women, they're coming in, they're like, I'm having these hot flashes and I'm constipated. I'm like, your engine's overheating. Mm-hmm. So in TCM, going to the washroom is a good way to reduce heat, especially heat in the large intestine. And then really it's another way of saying like you're just detoxing. You're getting rid of this excess hormone that, your irregular cycle is no longer able to regulate. Right. And so they start cooling down and less hot flashes and more regularity and feeling.
Just by getting them to.
More fiber.
Okay.
Yeah. I mean, in some cases it's not sufficient, but for some, especially if it's like mild, it's like, I'm having daily hot flashes. I'm surviving, but it's just like, I kind of feel it. I'm like, can we do something? I'm like, fiber. I'm like, you're constipated, right? They're like, well, it's not like what it used to be.
So when you say fiber, are you saying just from like fruits and vegetables or?
Anything and everything.
Okay. Yeah, a lot of flaxseed.
Yes.
Yeah, definitely flaxseed. It's also interesting because in a lot of times, not everybody, but when you're going through menopause, you might start gaining weight and then they think like they need to cut out those complex carbohydrates, which are really good and have a lot of fiber, like things like brown rice, sweet potatoes, all of that. Mm-hmm. So they might be cutting all of that out because they think they need to lose weight, but they're actually doing themselves more harm than good by cutting those things out.
Absolutely.
Yeah. And it's something I find with different diet programs people follow is that they're adopting something that seems very healthy in theory, but they're actually like, they're starving their gut.
Yeah.
Mm.
So like not enough healthy starch. I mean, then there are people who have way too much.
Yes.
Right.
Yeah, it's interesting because I'm also a holistic nutritionist.
Okay.
So it's like you hear about all these, superfoods and healthy foods, but they're not necessarily going to be healthy for you. And as being able to know which ones are ideal for your metabolism and for you as an individual is almost, there's a little bit of a puzzle, right? You got to discover what are those foods that are best for you.
Right.
Yeah. Maybe that broccoli and kale, raw broccoli and kale are not really good for you because you've got, a suboptimal thyroid, problem. So,
and also raw food, I find is just way harder to absorb the nutrition from it. Yes. And sometimes the cooking process is necessary to release that.
Yeah, lightly steaming.
Yeah. So it's a hard sell sometimes because we have these fixed beliefs. It's like, okay, well, I mean, this should be healthy for me, right? I'm like, well, I mean, maybe, but maybe you're not getting it. Maybe you're not, receiving it as you should.
Yes, exactly.
But it was a good transition to hormones.
There you go.
See that? You planned that.
So we're going to talk about Dutch now.
Mm-hmm.
Dutch is an acronym. It stands for Dried Urine Test for Comprehensive Hormones.
I thought it came from the Netherlands.
No, you didn't. Did you really?
Well, I mean, there's other tests that have come from countries. There's like the Greek test and the Spanish test. Oh, there's a bunch.
I'm not familiar with those ones.
All right, so give me the Dutch.
Yeah, no, it's an acronym. And so I would say that dried urine hormone testing is probably the gold standard right now for testing hormones, because it's not only providing information on your levels of hormones like a blood test would do or saliva test, but it's also providing information on metabolites as well. So the Dutch test we offer, or the one I'm going to talk about, is the one from Precision Analytical. But there are other laboratories also doing dried urine testing, just so you know. But the one from Precision Analytical is the one that's most often ordered. Okay. They have 3 main tests, which is Dutch Complete Plus or Dutch Plus, and then cycle mapping. The Dutch Complete is their flagship test. It's the one that's most ordered. It's a 1-day collection. It's timed. The patient has to collect their samples at 4 specific times during the day. There might be a little bit of preparation, certain foods or supplements or even medications that the patient might have to avoid before actually collecting their samples. It includes androgens, so DHEA, DHEAS actually, testosterone and any downstream metabolites. It includes your estrogens, so your esterone, estradiol, estriol, as well as the phase 1 and phase 2 detoxification methylation. So how well is the patient able to methylate and get rid of those estrogens in their body? It includes metabolized cortisol and cortisone, free cortisol and cortisone as well. And there are some extras, such as melatonin is reported, an oxidative stress marker, which is 8-OHDG, and 6 organic acid markers are also reported in that one test. So a lot of information, very comprehensive.
It's a huge amount of information. Yeah. I don't think people realize what they're getting when they do it.
Yeah.
It's like it can be it's overwhelming for myself. Like I always adopt to the opportunity to speak to one of the experts. And to them it's second nature. But like, I mean, I always have a consult with someone and it's like, okay, this is the case. Makes sense. Like, what am I looking at here? Yes. And then you can, they will do such a great job of outlining. It's like, okay, well, this person is off. They almost like go into character traits because it's just patterns. You start saying like, this person must be, semi-retired and they're not as active and they're tired but they're tired all the time, but they can't relax. And I'm like, yeah, like, that. And it's like, okay, well then, their cortisol, and this is why their 4-point cortisol is all over the place. Right. We never get faxes. That's amazing. I didn't even know what that was, and I saw the lights show up. Are you comfortable with the Dutch?
Yeah, I like the Dutch. Yeah. I really like the cortisol part of it too, like how it will show you what the curve should be like and where they fall within that curve. I find that really helpful. Yeah,
absolutely.
Patients like it. I think because, I mean, there's the visual part where it looks extremely comprehensive. And I think sometimes people appreciate that, even though it seems like maybe cynical to be like, well, they just like colors. It's like, well, it's way better than just giving them a bunch of numbers that don't have a context. Now they have pathways. Now they have like lines that point to things. And it's like, well, then this becomes that. And then this is from the liver. And it's like, oh, okay. Like now it's a learning process and it's a positive experience because it's not like you're just saying, well, you're abnormal. No, it's like, but this is why it's happening. And these are the recommendations. And this is what's been tried and true.
Yeah. Because the results are reported along the steroid pathway. So you as a practitioner have a really clear picture of where the problem might be along that pathway. So you can better like address and treat that patient.
Yeah. So I've had perimenopausal women. I've had, women that are, going through like some fertility or they're thinking about it. And then I've had even like young women that have like irregular periods. Their period stopped. They're not sure why. And I think it's a missing piece that a lot of doctors and like, I wish it was a little bit more mainstream because if they like in terms of like the gynecology and MDs, it's probably gonna take some time. I'm sure once 1 or 2 of them that are like, the big wigs, they pick it up, I think it'll kind of catch on. Because when you do like just like blood work for female hormones, like I just tell people, it's like it'll tell you you're in menopause or you're pregnant and nothing else. Because like some stuff has to be really, really off for those basic hormones to be like out of range.
Yes, exactly.
So like a lot of times they'll do that basic blood work, a female hormone panel, which is fine, but then it's like, well, it's all normal. It's like, well, you don't feel normal. You don't look like things are not normal for you.
Yeah.
So
you'll
that's
have
where
to
the
dig
Dutch
a
comes
little
in.
deeper.
Yeah.
Exactly.
I find that it's helpful in conjunction with some blood work. Like, for example, things like LH and FSH, can't get those in the Dutch. So I find like having the Dutch for all of that stuff and then having the blood work to do things like prolactin, LH, FSH to get a bit more comprehensive everything is good.
That's a good point.
Yeah.
So we can't throw away the blood test. Yeah.
Yeah, I don't think we can completely throw it away, but I think it's good to have both of them. And the Dutch gives you so much more information that the blood work doesn't.
Mm-hmm.
Yeah.
Right on.
So that's Dutch Complete. And then they offer Dutch Complete Plus. So it's exactly that same test plus a 5-point salivary cortisol awakening response.
Okay. I think I jumped ahead when I just talked about cortisol.
Yeah, I think I did too.
That's okay. That's okay. I mean, because it does report out cortisol in the Dutch Complete. The Dutch Plus is, so you're still going to get the dried urine information with respect to cortisol, but then the salivary portion is capturing a lot of information within that first hour after the patient's woken up.
Oh, okay.
So
I don't think I've done that one.
Probably not. You can order the cortisol awakening response on its own, or you can order it as part of the Dutch Plus.
Okay.
Right. So that's very comprehensive. And so the patient, this is a good test, ideal for patients who wake up with anxiety.
Wow.
Or even aggravated anxiety or pain, aggravated autoimmune symptoms in the morning.
So what markers are being measured?
It's just free cortisol and cortisone.
Oh, okay.
But you're getting a lot of information within that first hour after a patient's woken up.
Okay.
To understand a little bit better, like what's happening with cortisol, to see like how is that contributing to aggravating those symptoms.
Does it give any like insight into how to treat, or is that something maybe like one of those consults would be useful?
You should do a consultation for that. I don't think it's reported.
Okay.
There will be a summary of the report and evaluation at the end, but I don't know that it's necessary.
Okay, because that's a nice added piece, right?
I do have a treatment guidebook from Dutch that I can send you both, and then that will help you. Gives you a lot of information on supplements, dosages.
Nice.
Sort of thing.
Okay.
Yeah, absolutely.
So is that one, the salivary one, just the morning one? Is that what you're saying? Or do they do like a 4-point as well?
It's a 5-point.
5-point.
So in the Dutch Complete, the patient's collecting their dried urine samples one of two ways, either the night before, so at 5 p.m., 10 p.m., upon waking and 2 hours later, or they do it all in one day, upon waking 2 hours later, 5 o'clock and 10 p.m. Okay. Then there's an extra sample in there too, in case the patient has insomnia. They can collect that 5th sample. Right. The cortisol awakening response is upon waking. It's a saliva sample. It's actually a cotton swab that they hold in their mouth for 5 minutes. Oh. So it's very easy to collect the saliva. They're not spitting into tubes. So the first sample is collected upon waking, then 30 minutes later, then 60 minutes later, then in the afternoon, then at night. So that's when it's collected. And you'll see that curve.
Okay. So there's a standard expected curve and where you sit on it.
Exactly.
Okay.
Exactly.
All right. Well, we're going to have to do that next time.
Okay. Yeah. And then the last one, which you also touched upon for patients who have infertility, is the cycle map test or cycle mapping. And that's the month-long test. It's 25 urine samples that are collected at specific times during a woman's cycle. 9 of the most representative samples are reported in the report. Okay. And it's reporting out estrogen and progesterone. So obviously there's a natural curve for estrogen and progesterone depending on a woman's cycle. And because the patient is collecting all month long, you'll have a very good indication of if they're ovulating, when they're ovulating, because it is a test that would be excellent for any woman who has infertility issues, as I mentioned, women with cycling hormones but no menses. Any woman who has got an irregular cycle with irregular symptoms that are month long, women with progesterone IUDs or coils, and again, who are not bleeding. Women who've had partial hysterectomies, but still have their ovaries, and again, no bleeding. Anyone with PCOS, or for women with PMS or mid-cycle spotting or migraines. So again, it's a good test because then you'll be able to see their levels throughout a month. And then you can add on additional tests too. You could add on a Dutch Complete, or you could add on just adrenals or just sex hormone metabolites if you wanted.
Wow.
Yeah.
I've never done that one.
No.
It's
really comprehensive. It's like it's a lot of
a lot of work for them.
And I'm sure that
Right,
if
but-
it's very much for someone that is going through the fertility process,
Yeah.
and they're like, well, I
Yeah.
want to turn over every stone, so
Yeah.
I'm committed to it.
Yeah.
Yes, exactly.
Okay. Wow.
Because it gives you that really big picture of what's happening all month long.
Yeah, for sure.
Especially for a woman who is not bleeding and should be and is still in her menstruating years.
Mm-hmm.
It's like, why are you not bleeding? So where's estrogen at? Where's progesterone? Is it just like flat the entire month, or is progesterone surging too soon, or vice versa? So.
And is that the way that they would do the samples? Is that the same as they would do it in the Dutch?
Yes.
Okay.
So I believe it's every morning they're collecting the sample.
Every morning.
Yeah.
Okay.
Really good info. That's awesome. Do you have something else? Was that the main? Every time we talked about Dutch, I was like, well, I got another one. But there's those three main.
Three main from Dutch. Any others from Dutch? No, those are the main ones.
Okay. Any other tests you wanted to bring up?
Like I said, like mostly the conditions that NDs are dealing with seem to be hormonal and gut related. Wanted to ask you, like, were there any others that you wanted me to mention that you see in practice? Did you want me to talk about SIBO, for example?
SIBO would be interesting.
Yeah.
I've done a few SIBO tests, and almost every time, I think only one person that they didn't test positive. So I mean, I guess I've been lucky, presuming that they did have some form of SIBO, or it may just be an element that whatever their gut trauma is also revealing some SIBO in addition. Because I have someone that they wanted to do H. pylori testing. I'm like, okay, let's do both, because you might be negative for H. pylori but positive for SIBO, and vice versa, or both. So that's what we ended up doing, and he was positive for everything.
Yeah, that's tough. You can see why they were feeling rough.
Yeah.
Okay, so I'll pull up some notes on SIBO here. I think I have it. So SIBO is a breath test. It is a 3-hour-long breath test. So very important for the patient to follow the prep diet 24 hours before taking the test. That means that they can't take any sort of vegetables. They can't consume any sort of vegetables, not even vegetable broth can be consumed. It would be a bit tricky to have a vegan doing this test because the foods that they can eat cannot be changed. So they're pretty much white rice, white bread. Otherwise, it's like animal protein that's consumed, eggs, fish, beef, chicken.
Now, before I don't want to interrupt, but I do want to interrupt. Like, is that like would it be safe to say that for some people vegetables will aggravate their SIBO?
Yes. Which is why they have to avoid eating those foods to take the test.
Well, how about after the test when you find out that you do have it?
Well, you were going to treat them.
Well, I'm
or
just
get them to eat, the foods that are a little bit easier to digest.
To me, that
Yeah,
I'm thinking as a patient, and I'm like, but I'm eating vegetables, and now you're telling me that's bad too?
Well, it would be for a small, I think it would be temporary.
Yeah.
I'm sure there are SIBO diets out there. I'm not super familiar with what those SIBO diets are. They could be like low FODMAP.
Similar to like a low FODMAP, yeah.
We're putting patients through a lot. But I mean, that's why we got to treat them and fix them.
How long did it take them to get to the point where they're at?
Years.
So there you go.
Yeah.
So, it's not a quick fix. Definitely not a quick fix.
No, that first month is brutal.
Yeah. For I think when you're going through any sort of treatment protocol, it's always a bit of a struggle, right? Yeah. Your body's detoxifying. You got all those die-off symptoms.
Well, that's the thing is like a lot of times I'll get them on a diet and they're like, I feel worse. I'm like, yeah, I know you. I kind of knew that. I didn't want to tell you.
Yeah. No? Oh.
Well, if you tell them, they will definitely feel worse.
I sometimes will tell them. I'll say during the die-off phase, you might not feel the greatest. Yeah. But that's true. Then they might expect it.
Yeah. Or they don't feel good and they'll just assume it's because what I'm giving them.
Yeah.
Oh, so that's interesting. I always feel like you should, prepare people for what to expect, but I've never thought then they actually might start experiencing.
Yeah, the self-fulfilling prophecy.
That's true.
I mean,
but die-off is real.
No, I know. But sometimes it's just the perception of some people. I think I just deal with a lot of people that are like a little bit negative and fed up. So if I'm going to tell them you're probably going to feel really crummy, then they're going to be like, I definitely felt crummy. Whereas if I'm like, you should start feeling better right away. Someone's got Uber. Wasn't me.
And then if you tell them they're going to feel better right away, you've noticed that they
They
like,
do?
yeah.
More often than not, if I don't say anything, they don't say that they felt poorly.
Oh, interesting.
Maybe they don't want to admit it.
Most people around here.
Yeah, that's interesting. But I actually did the SIBO test. So I know
Okay.
what you're saying about like, you can't have any. I remember just eating like rice and eggs
Yep.
before the test. And yeah, it's
only 24 hours.
It's only 24 hours, so it wasn't that bad. But I can't
We're giving it
remember.
a bad rap, eh?
I remember I was like, I had to go somewhere and I had to bring rice with me. I don't. It's just what I remember.
Well,
'Cause
yeah.
It was a wedding.
I was out for the day and I couldn't like get takeout because I wasn't sure what would be in it. So I literally just brought a bowl of rice with me.
You know, it's funny because then
That's a good point.
you
Yeah,
can't have
to
the
be careful.
vegetables, but then during the test, you're drinking like a gallon of Kool-Aid.
Oh, that was horrible. Yeah.
It
Yes.
tastes good, doesn't it?
Oh no, I don't.
No,
think
you
it
don't. You
tasted
just
good.
turned off
Didn't?
sugar.
No, I actually had a bad reaction. I don't want to take you off topic here, but
Oh,
I
bring it
had
on.
like a bad reaction to it
Okay.
where I went home and I started just feeling really nauseous and dizzy and
Probably a SIBO.
losing focus. No, but I actually didn't. I tested negative. I just started like losing focus and sweating and my heart was racing and like I couldn't like grab things properly. It was like I got really,
wow.
really, really
Yeah,
sick.
maybe you had a hypoglycemic, like from that you crash afterwards
I'm
at
not
high sugar.
I don't
Probably what it
know.
was.
And then they told me, they said maybe we gave you too much
Yeah,
based on your body, based on your weight,
body weight.
and
Yes.
they didn't
weigh you,
they didn't weigh
and
me or
you're
take it down,
smaller
and I'm
frame.
smaller frame. And then they said you may have got like a laxative poisoning because it can act as laxative. And it was not
Was that part of it?
was not pretty. I was vomiting and yeah.
And how did you feel afterwards? After like a couple of days
It
later?
took me some time to feel
It did,
better.
right?
You have to
Yeah,
bounce back
I
from
didn't
that.
feel good. Yeah, so
Yeah, I've
not
heard-
hating on the
heard-
test though.
Yeah.
My gosh, I love the test. I'm sorry,
No,
I
it
just
is-
went
it
through
is a
the
great
ringer
test.
with it.
It is a great test. So
It is,
basically, there's two substrates that the patient can take. I'm assuming you took the lactulose.
Yes.
Yeah.
Yes.
And then there's glucose. And glucose would be taken by somebody who's lactose intolerant because there is a little bit of lactose in the lactulose
Right.
substrate. So there's two different ones. I have heard, and I think this might not be the case anymore, but because glucose is metabolized so quickly, it would be better for a patient who's got like a SIBO diarrhea picture because their transit time is so fast, whereas lactulose might be better for somebody with a SIBO constipation picture instead.
Oh,
It's
that sounds like
metabolized a
an
bit slower.
interesting
know.
theory.
Yes.
Okay.
Okay, so there's the two substrates. So basically, the patient will wake up, they'll take their first sample. It's their baseline sample. After that, you take the solution, you drink it, you wait 20 minutes, take your next sample. Wait 20 minutes, take
And you
your
blow
next
into
sample.
a little bag.
Yes, so I have to stress and emphasize that it is very important that the samples are taken correctly.
Mm-hmm.
Because they are breath samples, you cannot differentiate. A lab technician cannot tell looking at a tube if the sample is breath or room air. And so there are some patients who will actually pierce the tube and then blow into the, the applicator.
Mm-hmm.
And they're actually because the tube is in a vacuum, they were actually collecting room air. And so it's very important that they're collecting their
Mid-breath?
Yes. So they puncture the tube mid-breath. So you're breathing for 2 seconds, then you insert the tube, keep breathing, two more seconds, release it, keep breathing out for 2 more seconds. So they're breathing out for 6 seconds, and between seconds 3 and 4 is when they're collecting their sample.
Sounds very technical.
And I do this to see you're
And I've done
puncturing
it.
the
I've done
applicator.
it for patients, so I know.
Yeah.
Yeah. It's you get the hang of it, and you
But-
get to know the patient really
And
well
the
after 3
reason
hours.
why I'm emphasizing this is because the only way the lab will know if it was room air or breath is after they've run every single sample.
Okay.
And then the results are void. You can't use them. They're useless. And then we will get calls asking if the patient can redo the test. And the labs who do the test, we work with St. Mary's Hospital. And we might be adding on another provider as well. It's difficult for them to be able to say, sure, no problem, just redo the test for free.
Yeah, it's just another 3 hours of my life.
Right. Yeah. And that's the other thing. You don't want the patient to go through another 3 hours of that, but it can happen. So it's very important that the test be taken correctly the first time.
Sure.
Right? So some of the symptoms of SIBO and why somebody would want to take it, abdominal bloating is common, belching, heartburn or reflux, gas, abdominal pain or cramping. They're facing a lot of constipation or diarrhea. Again, irritable bowel syndrome, that seems to come up a lot. So it can be for a lot of things. Carbohydrate intolerance, which I don't know, maybe that was a little bit of what you experienced too, but it seems like it was a lot of just too much sugar. And those would be the primary symptoms of SIBO. And then some of the causes could be from the overuse of antibiotics,
Right.
which I'm sure you deal with a lot.
Definitely.
I don't think they're prescribed as readily as before, but yeah, antibiotics.
I find it's hard to get people to get on antibiotics when they need it. It's almost like they were like, oh, you guys thought we were over prescribing. Hey, okay, well, no one's going to get it now.
So now even the patients are saying they're resistant to them?
Well, I think it's case by case. Like, I mean, there's a lot of women who have like frequent UTIs and they're on 6 months of antibiotics, and that kind of just, that's a very specific case. There's some people that have like, they need an antibiotic and it's like, nah, you're fine.
Wow.
It's hit and miss now. Before it was like kids with ear infections, they were on antibiotics for like a year straight.
Or anytime you have a sore throat, they put you on antibiotics.
And there is times when I think it's necessary. Like I've seen people where they have like, they're repeatedly getting sore throats and then a strep infection right afterwards. So it's like with that knowledge, you have to know like, okay, let's just anticipate this so we can avoid you being sick for 6 weeks. But back in the day, everyone left with some bubble gum or banana flavored. It was delicious.
I remember the banana flavor. That one was good. Yeah.
That's true.
Everyone has their favorite antibiotic.
Anything that was sweet. Yeah. Some other causes could be dysbiosis, which is an imbalance of normal gut flora. I know you know, but maybe your patients don't know what dysbiosis means.
If we just suspect dysbiosis, like let's just say someone's tummy is just like they're bloated all the time. Dr. Amanda, what do you say? What would be the test? Would it be the GIMap? That would be the best catch-all?
I personally would do the GIMap or the GI 360 just because you're getting, like, you're seeing everything to figure out. You're not just saying, okay, is it SIBO or is it H. pylori? You're able to look at everything to see in case it's like candida or something like that.
Yeah, I think for me, like if someone's coming in and they don't know if they have H. pylori or they heard about SIBO, then I'm much more inclined to pick SIBO first, just because that's what the patient has, that inclination. And so whether it's an intuition or just to appease them or like put their mind to rest. But otherwise, I think the GI 360 is the best.
I think, you have to look at the other symptoms too. Like it's usually in combination with some like belching, nausea, bloating.
Upper digestive.
Exactly.
Yeah. Whereas if it's lower, like going to the washroom, it's the stool testing and stuff. Yeah.
Exactly. So the SIBO test reports out the patient's reaction, or not reaction, but it's reporting out two gases, which are methane and hydrogen. Yeah. So it's not going to necessarily identify any sort of specific bacteria that it could be causing.
It's non-specific. It's just you're fermenting something in there.
Exactly.
Yeah.
Exactly.
Okay.
So, but again, it's a very I shouldn't say popular. It's a very commonly ordered test right now by NDs.
For sure. Yeah. I think SIBO has a lot more notoriety. A lot of people are talking about it. It's almost like a new disease, disease of the week.
Yeah.
And people who have been struggling trying to figure out what they have, they're like, oh, maybe I have that.
Yeah.
Mm-hmm. Yeah.
So now we can test it.
Exactly.
Good.
Exactly.
Okay.
Great.
Was there anything else you got on your laptop?
Well, I'm sure you've looked at our price list. We have several tests that we do offer. And so those would be like some of the 3. Food sensitivity, organic acids testing is one that's often ordered as well.
Maybe I'd like to know if you can share just a little bit, like highlights for the organic acid testing.
The organic acids test. Oh, I didn't read my notes before coming.
That's you know more than everyone else. So
that's true. So organic acids test is the first morning urine void test, and it's looking at it's reporting out 76 different metabolites and looking at different systems in the body. So looking at bacteria as well. Could identify if the patient has been exposed to mold potentially. It'll provide you with information on yeast. So if they're a rabinose would be the metabolite for yeast. If that is high, then patient likely, will have like some sort of candida. There's information on the Krebs cycle metabolites, uric acid metabolites. It's also giving you information on oxalates, oxidative stress. There's some markers on that, as well as neurotransmitters. It's a very comprehensive test.
It's very broad. And I think it's good for someone who just doesn't feel well and they don't know why. They got a smattering of different symptoms all over.
It's a good test for anybody who's facing some sort of anxiety, depression, which is common right now after what we've gone through the last 2 years, and also is complaining about gut issues. As soon as you have the yeast and the oxalates, and there's one other marker that I'm forgetting right now, but as soon as you put that under control, then you'll see that the patient starts to feel better right away.
So it's like the second brain, like your gut is affecting your mood.
Yeah, could be. And because it's giving you information on some of the neurotransmitters and metabolites for those, then yes, you can get a very big picture on what could be causing that. I mean, when I started 5 years ago, it was kind of known as the ADD, ADHD, HD test for kids. But I think it's broadened now. We're looking at a lot of other sort of
I like that
neurological
idea.
conditions.
I like when we have a very specific test and we stop applying it to just one little focal group, and we realize everyone should know where they, like, what their map is or what their layout is, or if they have any deficiencies. Because I mean, I that's how I know about organic acid testing, is for like the autism and ADHD spectrum.
And it's interesting because that seems to be very specific to either Ontario or Canada. But when I was speaking to the rep, Scott Shaw from Great Plains, that's the laboratory that does the test, he was telling me that in the US, doctors or functional medicine practitioners, naturopathic doctors, et cetera, are using it more for gut health.
Makes sense. Yeah.
So, because it's reporting out not only like the dysbiotic bacteria, but also good bacteria as well, to a lesser extent than any of the stool microbiology tests, but it does provide that information as well. It's got a lot of great information on this one test, and it's so easy to collect. It's just a first warning void.
Yeah.
And children can take it too if it's a smaller child who happens to be in a diaper. Pediatric bags can be used to collect the urine sample as well.
That's really good.
Yeah.
Okay. So that's you bringing it up kind of like refreshes it in my mind of like, why not use it a little bit more often, especially when, I mean, in my mind, it's like maybe like an uncertainty of what I'm dealing with. And but there's the gut stuff and some mood stuff. And I mean, developmental, because I mean, I'm sure when the origins or it kind of coming from the autism focus, that there's something like a delayed milestones, or, maybe, not playing well with other kids, or your kid looks a little bit different. And it's like, okay, I just want to make sure that there's no deficiencies or I'm lacking something. And even with kids that are like picky eaters or they have horrible sleep, at least this way we're like, okay, let's investigate. Maybe there's something here that is not just a behavior thing. It's not just like, maybe they just lack, maybe they're lacking.
And that's why that test is so great.
Yeah.
Because there are a lot of markers in there that if they're elevated and you bring them back under control, you'll find that the child or that person will respond very well.
Yeah.
So it's an important test for sure.
Awesome.
That's great.
Are there any other tests? I would say yes, but maybe we can, if you want, I can come back another time. I can talk about some of those other tests that are maybe less well known, but still really great to know about.
I think that makes sense because I mean, we've already been over an hour. Well, I mean, you guys been sitting there. We've been live for 50 minutes, but it's a good time to wrap up. So, any parting thoughts or any? Yeah. This was very useful.
That's great. Yeah.
Great.
Thank you.
Thanks for having me.
Yeah.
I appreciate being here.
It wasn't so bad, was it?
No, it was fine.
Yeah, it was fine.
Did I look nervous?
No, it's just those 4 emails beforehand.
You're like, it's casual. I'm like,
I need to prepare. It's like, more than everyone. That's why you're here. You're the expert.
Oh, well, thank you.
Thank you, Dr. Amanda, for joining us.